Now we begin tonight with what could be a roadmap to the reopening of the economy in the next 30 days. The National and County Governments Coordinating Summit, chaired by President Uhuru Kenyatta, met today and resolved to begin the process of easing the COVID-19 restrictions. A special committee has been put in place to review all the proposed protocols and report back a week from today. We're going to begin our broadcast with our very own Chemutai Goin, who reports on the development that came as Kenya crossed the 3,000 mark, with 105 new infections confirmed in the last 24 hours.
The intergovernmental meeting took place on the backdrop of President Kenyatta's speech that outlined grim scenarios on COVID-19. But with the economy feeling the heat of the restrictions, the committee is seeking a roadmap that could get the economy up and running again in 30 days' time.
This extraordinary summit congregates to ponder and to sanction the development of time-bound protocols for the progressive reopening of our economy. And this is important because, ladies and gentlemen, the COVID-19 pandemic is both a health crisis, but it is also a crisis to our economy as well.
With the reopening plan coinciding with rising numbers and inadequate testing, the government is leaving nothing to chance. Counties now expected to boost their bed capacity to cope with a possible surge in new infections.
This is a challenge that calls our county government to be a heartbeat away from our sick ones, with the national government giving you all the support that we can.
County governments have put in place restriction guidelines of social distancing, including the social gatherings at markets, hotels, churches.
A lot of the handwork is essentially at the county level. We have seen various degrees of success and admittedly failures. Even when the challenges come, we have worked together. We have not assigned blame.
Already Education Cabinet Secretary Professor George Magoha and his interior counterpart Dr. Fred Matiang'i have been directed to hasten the process of reviewing proposed suggestions of reopening of schools and religious institutions. Kenya's economy has been battered by the virus, which has led to a reduced revenue, loss of jobs, closure of establishment and a bruised import and export market. The reopening plan expected to be an antidote to the ailing economy. A committee within the summit has now been put in place to review suggestions that have been floated, including the gradual reopening of worship places and lifting of some of the restrictions. Its report due within a week when another meeting will be held. As part of the reopening plan, the Health Ministry launched its home-based care program for COVID patients in an attempt to decongest health facilities, which have now been overrun. In the last 24 hours, the country's total infections spiked by 105 to 3,094. However, the highest ever number of discharged patients was recorded, 175 people allowed back to their homes, with 80% of the confirmed cases being asymptomatic. Going forward, those not exhibiting signs or with mild symptoms and those that do not have pre-existing conditions will be managed from their homes in line with the new protocols.
Community health volunteers will be involved in the daily assessment of home-based patients and will be the key link between healthcare workers and the households.
Easing of the restrictions imposed will definitely result in more movement. This will be the new headache for the government as it moves to contain a possible outbreak of COVID-19 at a time when the country continues to record increasing number of infections. Chemutai Goin, Citizen TV, Nairobi.